Hi friends, I'm Dr. Jeev Ram. Today I will discuss about nasal polyps and its treatment. There are two types of nasal polyps: bilateral ethmoidal polyp, Antrochoanal polyp. First I will explain bilateral ethmoidal polyp in detail. Etiology: inflammatory conditions of nasal mucosa, rhinosinusitis, disorders of ciliary motility called Jenner syndrome, abnormal composition of nasal mucus, cystic fibrosis. Various diseases are associated with the formation of nasal polyps or chronic rhinosinusitis called Jenner syndrome, cystic fibrosis, asthma, aspirin tolerance, allergic fungal sinusitis, Young syndrome, Churg-Strauss syndrome, nasal mastocytosis. Pathogenesis: nasal mucosa becomes edematous due to collection of extracellular fluid, causes polypoidal change, then it causes sessile pedunculated polyp due to gravity and excessive sneezing. Pathology: early stage nasal polyp, surface covered by ciliated columnar epithelium, metaplastic change in exposure to atmospheric irritation, causes transitional and squamous epithelium. Submucosa: large ICS filled with serous fluid, plus infiltration with eosinophils and round cells. Sites of origin: multiple nasal polyps always arise from the lateral wall of nose, usually from the middle hiatus. Common sites: uncinate process, bulla ethmoidalis, ostia of sinuses, medial surface and edge of middle turbinate. Symptoms: mostly seen in adults, nasal stiffness leading to total nasal obstruction, partial total loss of smell, headache, associated sinusitis, sneezing and watery nasal discharge, associated allergy, protruding mass. Signs: on anterior rhinoscopy, polyps appear as smooth, glistening, grape-like masses, often pale in color, may be sessile or pedunculated, insensitive to probing, do not bleed on touch, often multiple and bilateral. Broadening of nose: increase intercanthal distance, may protrude from the nostril and appear pink and vascular, simulating neoplasm. Purulent discharge, associated sinusitis. Diagnosis: clinical examination, CT scan of paranasal sinuses, exclude neoplasia, plain surgery, histological examination, especially in people greater than 40 years. Conservative treatment: antihistamines and control of allergy, may revert early polypoidal changes with edematous mucosa to normal. Short course steroids in people who can't tolerate antihistamines or with asthma. Surgical treatment: polypectomy, intranasal ethmoidectomy, extranasal ethmoidectomy, transantral ethmoidectomy, endoscopic sinus surgery. Now I will discuss antrochoanal polyp. Site of origin: arise from the mucosa of maxillary antrum near its accessory ostium, comes out of it and grows into the corona and nasal cavity. Thus it has three parts: antral, thin stalk; choanal, round and globular; nasal, flat from side to side. Etiology: exact cause is unknown. Nasal allergy coupled with sinus infection is incriminated, seen in children and young adults, usually single and unilateral. Symptoms: unilateral nasal obstruction, bilateral nasal obstruction when polyp grows into the nasopharynx, starts obstructing the opposite choana, thick and dull voice, hyponasality, nasal discharge, mostly mucoid. Signs: anterior rhinoscopy may be missed as it grows posteriorly. Large smooth grayish mass covered with nasal discharge, soft, can be moved up and down with probe, may protrude from nostril, shows pink congested loop. Posterior rhinoscopy: globular mass filling the choana or the nasopharynx. A large polyp may hang down behind soft palate and present in oropharynx. Investigations: nasal endoscopy may reveal choanal or antrochoanal polyp hidden posteriorly in the nasal cavity. X-rays of paranasal sinuses may show opacity of the involved antrum. Lateral view X-ray shows globular swelling in post-nasal space, column of air behind the polyp. Differential diagnosis: a blob of mucus disappear on blowing nose, hypertrophied middle turbinate, pink appearance, hard feel of bone on probe testing, angiofibroma, history of profuse recurrent epistaxis, firm in consistency, easily bleed on touch, neoplasms, fleshy pink appearance, friable nature, tendency to bleed. Treatment: avulsion, nasal oral route recurrence is uncommon after complete removal. In case of recurrence, Caldwell lung operation, complete removal of polyp from site of origin. Endoscopic sinus surgery is now preferred. This chart is showing difference between ethmoidal polyp and antrochoanal polyp. Ethmoidal polyp, age common in adults. Etiology: allergy or multifocal. Number: multiple. Laterality: bilateral. Origin: ethmoidal sinuses. Growth: mostly anteriorly and may present at the ears. Size and shape: usually small and grape-like mosses. Recurrence common. Treatment: polypectomy, endoscopic surgery, or ethmoidectomy. Antrochoanal polyp, age common in children. Etiology: infection. Number: solitary. Laterality: unilateral. Origin: maxillary sinus near ostium. Growth: backwards to choana, may hang down behind soft palate. Size and shape: tri-lobed, antral, nasal, choanal part. Recurrence uncommon if removed completely. Treatment: polypectomy, endoscopic removal.